First, this is ABC-7 Extra.
And welcome to another special weekday edition of ABC-7 Extra. I'm Eric Elkin. ABC-7 continues to bring you in-depth, interactive discussions to keep you up to date on the coronavirus pandemic and its effects on the borderland. And we welcome your questions and comments. You can share them right now to share@KVIA.com. Again, share@KVIA.com. On Friday, Governor Greg Abbott issued an executive order loosening certain restrictions on elective surgeries that were put in place to reduce the risk of spreading COVID-19. That order took effect today. So what does this mean for people in El Paso who need elective surgery, and in particular, cancer patients? Our guest today is Dr. Jeffrey Lamont with Texas Oncology. Welcome to you, Dr. Lamont, and thank you for taking some time this afternoon.
Yes, thank you.
Let's start broadly. What has this process been like for you as restrictions became tighter over the last couple of weeks and are now starting to loosen today?
Well, what happened initially was that there was an order that elective surgeries are not able to be performed. And what that means for a cancer patient is, well, hey, we can't do your cancer surgery. And throughout this process, that was a little too restrictive at first. Throughout this process, some cancers need to happen. Cancer care can't stop. So there are certain cancer cases that we have been doing all along, things that are going to get worse in a matter of weeks if we don't do them. So it's been frustrating because we're picking and choosing and treating our patients like we normally wouldn't. For example, keeping somebody on chemotherapy to delay their surgery. Imagine what a patient thinks about that. So it's been frustrating, and there's a lot of patients that have been delayed as a result of this.
And we were talking before, you have 210 locations, Texas Oncology, across the state of Texas, including a few here in El Paso. You mentioned that interaction with some of those patients, having to tell a patient that they're going to be on chemo a little bit longer. What are some of the frustrations that you had to deal with, specifically with those patients who are now already going through such an emotional experience trying to fight and battle cancer, and now have this wrench thrown into what would have been plans otherwise?
I mean, they want their surgery. I mean, they've got cancer. They want their surgery. And I mean, there are cases, like I said, that have to move forward. What about breast cancer, for example? You know, there's hormone receptor positive breast cancer. A lot of the recommendations have been to put those people on hormone treatments, which does treat the cancer, but it doesn't make the patient feel real well. So we're saying, look, we think this is safe. We think your cancer's not going to get worse. You're on this treatment, and we're going to delay your surgery. But you can imagine that discussion. I mean, that's us telling patients that we're going to treat you in a way we're not normally going to treat somebody, and it's very disconcerting. So it's kind of an emotional thing with patients. Absolutely.
All right, we have to sneak in a quick break, but when we come back, we'll continue to relay some of the questions that you sent to share@KVIA.com. You're watching a special edition of ABC-7 Extra. And welcome back to this special weekday edition of ABC-7 Extra. Our guest today is Dr. Jeffrey Lamont with Texas Oncology. We were just talking during the break, Dr. Lamont, about this idea with obviously elective surgeries, the restrictions being loosened now per the governor's executive order, but that doesn't mean just because this executive order is now in place that people can get their surgeries today, tomorrow, whenever the case may be. Obviously, a lag of insurance is a factor. Tell us about some of the processes that are now in place to kind of get the ball rolling again, since you had a pause on everything.
Well, you know, the whole policy has to do with any individual hospital, that your hospital can handle elective surgeries. So they have to have enough PPE to handle the surgeries, but still reserve enough to treat COVID patients. So that's one thing. The other thing is, what are individual hospitals going to do about testing patients? I work at a hospital that their new policy is going to be anyone coming in for elective surgery gets tested for COVID before the case. Well, that's not the day of, because that test is lagging a little bit. So people are going to have to come in 2 days before, get tested. They're going to agree to self-quarantine themselves and then have the procedure a couple days later. So it's not really how we normally work. And I will tell you that the efficiency of an operating room and the efficiency of surgery is really going to be different now than it was 3 months ago. The way we handle patients and putting them to sleep and that sort of thing is really different and a little bit more time consuming, as a matter of fact.
And I would think any patient going for a potential surgery would do everything in their power to follow all the guidelines that you're just talking about, the setting in place. But It also kind of strikes me that when you say that, obviously there's the lag in testing, so you're going to ask people to go home and quarantine. How can you ensure that people are actually abiding by those rules? And even if they come back with a negative result, then a couple days later that they're coming back and have abided by all the rules.
It's like the best you can do. So, I mean, we can't, there's false negatives to tests. We don't know what people are doing. We're telling them what they should do. They're doing intensive screening before about questioning family members, temperature, cough, all the symptoms. They're trying to do the best you can, but I mean, no system is perfect. And I think that there is no system that's going to be completely devoid of risk. So if, let's say, an elderly patient comes in for a surgery, they have multiple comorbidities or something like that, you can't guarantee that it's going to be completely safe. I mean, there's just no way to do that. Same thing with going to the grocery store. I mean, those things cannot be completely guaranteed. We just have to do the best we can with the resources we have. And it's cancer care that we're talking about. I mean, that needs to move forward. So I think that we need to do the best we can and be as cautious as we can. But then again, we need to be advocates for our patients and say, look, you have cancer. This needs to move forward. Let's move it forward in the safest way we can. That's what we're trying to do.
How much of a backlog did the last month create? Because obviously, had this not been in place over the last month, you would have been going about with surgeries, and now more people are needing more surgeries that have been waiting. How long will it, and maybe there won't be back to normal as we know it, but how long will it take you to kind of get back where everything is clicking?
It's, if you look at a total surgical volume, it does depend on exactly what sort of specialty you're in. If you're a breast surgeon, you could be 80% down on your cases and have, 60, 80, 100 cases in the queue to do. I think what's going to happen is that we are going to see an influx of cases that are going to come into hospitals and surgical centers. That's going to continue. I think we're going to see an influx of patients because, breast cancer screening, colonoscopies, all that's been on hold. So new cancer cases are going to start coming into the door again. So we're going to see a huge influx, we think, of cases that are going to probably occupy the rest of the year. Because, by the way, there's all the people that need hip and knee replacements and, other elective surgeries, and all that stuff has to be done as well. So the idea is, I think we're going to see the hospital systems really have an influx of surgical volume that's going to be lasting for many, many months.
Does that concern you then? Because that volume could mean more people in close proximity. I mean, obviously, I would imagine you're going to be doing everything you can to abide by social distancing guidelines and whatnot, and the testing that we talked about earlier. But, there's always risk there.
I mean, there's risk. Anytime someone, if you think the medical coming into a hospital is probably more risky than, going to the hardware store, I think, fair enough. We just need to do the best we can. I hope that the more we have testing available to see who's positive, who has had it, I think we can probably stratify patients and caregivers better than we are now, which is really not much. But I think, this is not really just a medical issue. It's a societal thing that I think we're going to see. Right. Are we going to have a resurgence in the fall? Are we going to have a resurgence when we relax other businesses? I think it's a medical issue. It's a societal issue, too.
All right, when the special edition of ABC-7 Extra returns, we'll continue to answer more of your questions, and we'll be right back after this. Welcome back to this special weekday edition of ABC-7 Extra. Our guest today is Dr. Jeffrey Lamont with Texas Oncology. And Dr. Lamont, you mentioned earlier the word frustration when it comes to this whole process. What has it been like? We talked about some of the frustrations and struggles with the patients. What has it been like for surgeons, doctors, nurses working in these hospitals? What has your sense been from working amongst your peers throughout the last month or so?
Well, surgeons want to work, nurses want to work. I mean, I think if you look at a nurse in the operating room, all of a sudden they go from a busy operating room schedule to, hey, there's nothing to do. So they want to work. They want to do cases. Now, I think people have been retasked to do different things. I work in a hospital that recycles masks, so we have a mask, we wear it. After a couple of days, we give it to them and they UV radiate it, and the nurses are doing that. So I mean, people are doing jobs that they're really not used to doing. And I think people are happy to work. It's like anyone else in society. You know, you want to work, you want to do what you normally do. Things are different for us. We've had to have new processes in the operating room that are very different as far as putting somebody to sleep and waking them up, and how do we do that? So it's different. I think we're all happy to be working, and I think we all want to work more. I think everyone's hungry to do more of what we normally do.
What kind of issue have you had any issues with in terms of PPE, or are there any concerns going forward about possible issues when it comes to PPE?
Yeah, I mean, normally those things are disposable. You use an N95 mask, you take it off, you throw it away. I mean, so what we're doing is we're reusing those, you know, and they give us brown paper bags, and we put them in there and we use them for a couple of days. They re-irradiate them. They'll issue us another one. We sign them out. I mean, whoever thought of that? Normally you do a surgery, you take your mask off, you pull it off your face, throw it away. You don't think the first thing about it. But I mean, there's been a whole, almost like a re-education process about masks and that sort of thing. And you think about, you know, the things that you're using in an operating room. So, I mean, the thing about us doing surgery is we need to do surgery. Now, we can't take away from the people in the ICU that need masks and gowns to take care of COVID patients. So it's a balance. So I would say that every hospital is different in terms of the saturation they have. Some hospital may not feel it and have enough PPE. Some hospitals don't. And then PPE in the clinic. I mean, in Texas Oncology, we bring cancer patients in. Some are getting chemotherapy. Some are sick, you know, and so we're having to have our nurses and our staff and our medical assistants they have to have the amount of PPE that they don't normally even really use. So it's really different, and I think everyone is trying to scramble for that. You know, if a hospital doesn't have enough PPE to do a surgery, there it is. I mean, that's going to be the end point to that. So I think that, you know, that is it's a frustration. It's unusual. We don't normally think about it at all. That's not even something we think about at all. So it's very different.
Do you think it's the new norm? I mean, do you think there's an end to that in sight, or do you think that's the way you will operate, pun intended, I guess?
Well, I think until you know, there's treatment or a vaccine that can really eradicate this, we have to proceed with caution. And in caring for patients, I think we're going to have to operate in a way that we're assuming people could have an infection, and we treat ourselves and we treat them in that way. You know, wearing an N95 mask, doing a surgery for a couple of hours, that is difficult. I mean, those things are difficult to breathe through. I really feel for the nurses that are in the ICU that would keep, you know, one of those on for an entire shift. I mean, it's just very difficult environment to work in. Yeah. And it's slower too. It's not terribly efficient right now.
We've seen the countless images from across the country of the marks on the faces of nurses wearing masks for long periods of time.
Right.
Dr. Lamont, I'm curious, we talked a little bit about the patient a little bit earlier, and obviously anytime you're diagnosed with cancer and you're going through this type of treatment, ultimately needing surgery, it's a very emotional process. What do you say, though, to patients and their families who think that they may have to choose between treatment and or social distancing to be safe right now?
I mean, you know, what we're trying to do is to try to keep the volume of patients out of our clinic that we can. Like, for example, if we can do a telemedicine visit, video chat, or something like that, we try to limit the amount of family members that come in. I guess my message to patients would be, though, if you have a cancer, or you think you have a cancer, or you have a lump or something, that needs to move forward. I mean, we can do it safely. We are screening people on the way into the clinic. On the way out of the clinic, we're screening the staff. So I don't think things need to be ignored. I think cancer care needs to move forward, very definitely.
Were you aware of any furloughs or layoffs that Texas Oncology had to go through, especially over the last month?
Have not. We have not furloughed. We had a policy that we decided we're not going to furlough our employees. And as a matter of fact, we've actually changed the way we've worked a little bit and had people work from home to try to keep people out of the clinic, that sort of thing. So no, it's a purposeful process that we said we're not going to furlough our employees. That being said, yes, I mean, if you look at the amount of patients that come through the clinic, that's way down. It's really down for surgeons. It is down to some extent for medical oncologists and radiation oncologists. No, but we're trying to keep our employees intact because we're going to need them. I mean, we're going to need the workforce here in the next several months to really catch up. So no, we're trying to retain our employees as best we can.
I'll finish with this. Do you think this is the right step moving forward now, at least loosening some of these restrictions, specifically how it affects you with these elective surgeries now being allowed again in Texas?
Yeah, I mean, it is. It's the right step. I mean, there's certain things that someone has appendicitis, that can't be ignored. You know, somebody has a blockage of the intestines, that can't be ignored. That's always been very clear. But I think that the longer you put off cancer care, the more likely, we could have an adverse outcome. I mean, we don't want to mistreat somebody because of another process. So we're trying to do the best we can and juggle our patients and get them in there. And I think what this allows us to do is do it with more confidence. I mean, we as surgeons don't want to feel like we're breaking the law doing a surgery. We're trying to do our best for our patients. So what we're trying to do is trying to make a case for the cases that have to go immediately. And then the ones that are more urgent, I think this allows us to really move forward with those. It's going to really help the process of surgical cancer care very definitely. We're very excited about it.
Dr. Lamont, we've run out of time, but I want to thank you for taking the time with us and also thank you for the work that you're doing.
Thank you. No, my pleasure.
Ours as well, and we'll be right back.